One of the most common reasons dogs are referred to Sierra Veterinary Specialists for care is for problems with their knees. More specifically, cruciate ligament problems. This is something people are often familiar with, having heard about ACL injuries in athletes or having experienced it themselves with skiing injuries or other types of athletic injuries. The similar ligament in dogs is called the cranial cruciate ligament, or CCL, in contrast to the anterior cruciate ligament, or ACL, in people. And there are some other significant differences in terms of how the process develops in dogs and how it's treated. In dogs, it seems to be more of a degenerative process in contrast to the acute athletic injuries we see in human beings. We don't really understand exactly how the process gets developed or progresses over time, but one of the things that's important to know is that, statistically speaking, within a year to two, you're going to see about 50 to 60% of dogs developing a cruciate ligament problem on the opposite leg. So when I sit down with owners and I'm talking to them about management strategies and what they need to do for their dog and the different surgical options that are available, I like them to know right off the bat that there's at least a coin toss chance within the next year or two that they're going to be doing it all over again for the second leg. When I sit down with clients to discuss cranial cruciate ligament problems in their pets, I like to talk to them about arthritis, because as a degenerative process, what we see is that the joint is inflamed, which is arthritis, and we see progressive deterioration of the structures within the joint, so progressive loss of cartilage and progressive damage to other structures, which is a debilitating condition and painful, and it gets worse over time. And what we're trying to do when people come in to discuss surgery for their patients and their pets, we like to know, what are we going to do to restore that pet to good function? And in doing that, we want to restore joint stability, because instability is part of the problem, and that's done surgically. But we also want to treat the arthritis and the inflammation that's going on within the joint. So we like to approach it from the standpoint of looking at diet and exercise, the surgical technique that we're going to choose for that particular patient, and then a good post-operative rehabilitation strategy. With diet, we see that a lot of our patients are coming in overweight, and certainly the obesity problem in pets in the United States mirrors the obesity problem that we're seeing in human beings as well. And so we know about overloading joints. Mechanical load of those joints when they're carrying around excessive weight causes progressive problems. But we also are discovering that adipose tissue by itself, or fatty tissue, has a role in endocrine and hormonal metabolism, and so we're seeing an increased level of inflammation throughout the body, and that includes the joints. So reducing weight in these patients is really an important strategy to helping to reduce overall inflammation and unload those joints. Then we need to look at the surgical options for repair. There are a lot of different options out there. There's a little bit of controversy, in fact, probably a lot of controversy within the veterinary profession about which particular procedure is best and so forth, and a lot of ongoing research. I think that the best technique to approach each patient is to know the pros and cons of the individual surgical procedures. What are the outcomes that you expect with them, what are the risks, and then knowing the individual patient that you're dealing with. So knowing what is this particular patient's needs, what is its function overall, what are the goals of the owners, and what other problems might it have. So individual diseases that the patient has that are in addition to the orthopedic problems it may have. And then tailoring a specific plan for how to approach that. So we decide what is the best surgical procedure, making sure the owners are informed about that, and getting a good weight management plan, a good exercise plan, and then after surgery having a good physical therapy and rehabilitation plan. So we're tailoring the amount of exercise and what kind of things the dog is doing during its recovery to its individual stage of recovery. Not every patient recovers at the same rate, and some patients may be a lot more advanced at a similar stage of time post-operatively than others, but the goal is to get them all to a similar place, hopefully, but with tailoring an individual program to each patient. Having an initial consultation with clients, one of the first questions I might ask is, what are your expectations? What do you expect your dog to be able to do? And then we look at the patient, look at the overall health, and we try and discuss if this is a realistic goal or not. In some cases it may be. In some cases maybe there are indications where we need to set the bar a little bit differently, or there are other problems that need to be managed concurrently to what we're dealing with in terms of the knee problem. And it falls right into discussing again what is a tailored approach to this individual dog, and how do we want to get it to where it needs to go. And the clients, I like them to have a lot of input. I like my clients to be as informed as possible about what's going on, because that helps to guide me as a surgeon in choosing what I think is the best management strategy for the patient that I have. This information is just an overview about this particular problem in dogs, and I'd like to stress overall that the best approach, again, and I think I've said this before, is to find somebody that is knowledgeable about this particular problem, knows the different surgical procedures, and someone that you're comfortable with, someone that you feel you can ask the questions that you need to ask, because I think it's important for owners to ask questions and get informed about what's going on with their patient, and that you feel like you're going to be able to have a good communication with, because this is a long process. It's not just a surgery and goodbye. It's preoperative management, deciding on what needs to be done, and then following through and really following up on your patients afterwards and making sure that things are going in the right direction and knowing that you're going to have somebody you can talk to and feel comfortable with throughout the whole procedure.